Welcome to Empowered Ease. I'm Jen Olinger. This show exists to challenge the patriarchy by celebrating women who help others in their way and in their time. Women who choose slowing down, self-love, and honest inner work over hustle culture. Beginning now, Empowered Ease will release new episodes twice a month on Mondays. Each episode brings you a powerful woman, a leader, a healer, a parent, or a caregiver, who invites us to pause, go within, and ask, who am I? What do I really want and need? We slow down together, we learn practical tools, and we reclaim our permission to rest, to receive, and to shine. So thank you so much for joining me. Please like, follow, and review the show so that you never miss an episode, and also because it helps us to continue to grow. So welcome to Empowered Ease. Welcome back to Empowered Ease. I'm your host, Jen Olinger, a holistic nurse coach. And today we're welcoming back a very special guest. I hope you all remember Dr. Darcy Graham. She is a DNP and owner and founder of Grit and Grace Wellness and has spent more than 25 years in healthcare, serving patients with compassion and expertise. These days, she's specializing in women's health, hormone replacement therapy, and medical weight loss. She helps women restore balance, energy, and confidence. She is a mother, a wife, a mother of 7, in fact, a dog mom of 3, and she deeply understands the real-life demands women face. She's passionate about providing realistic, supportive care that actually fits your life. This episode, Darcy Graham is back to dive deeper into testosterone and HRT. What you need to know, what often gets missed in traditional conversations, and how these therapies can be used safely and intentionally to support women's health at every stage. So let's get started. Welcome, Dr. Darcy Graham. So happy to have you back. Well, welcome back, Dr. Darcy Graham. I'm so excited you're back to talk to us more about testosterone and HRT therapy. How are you doing?
Good morning. I'm doing great.
For some of our listeners who may be new or didn't hear the last episode, which I think was like 2 episodes ago, can you just briefly reintroduce yourself and what you do and how you work with women's hormones?
Absolutely. I am Dr. Darcy Graham. I am a nurse practitioner in Alton, Illinois. My primary day job is a women's health nurse practitioner. I've been doing that for going into 12 years now. It's hard to believe it's been that long. And so given that I'm in women's health and in my mid-40s now, I've kind of taken on this role as getting very, very educated in hormone replacement therapy and kind of what women are going through with this perimenopause phase, which has been a very exciting time. A lot of changes this past year. So
it's a hot topic.
It is. I would say most of my new patients now in the clinic that I work in has just been primarily perimenopause, especially now that my name's getting out, that I'm doing all the certifications in it and getting more educated in it. So yeah, it's really exciting. So I do women's health with focus on menopause and perimenopause right now.
Yeah, I actually scheduled an appointment. It's just not till March. So I'm so excited to get started to speak to it as well. So
absolutely. I'm excited.
So we decided to do another episode focusing on testosterone because I know we briefly touched on it before, but I've been a nurse for 12 years, but I don't remember. I think it was after I graduated nursing school that I found out women also make testosterone in their body, that everyone makes a little in their brain and men just make a lot more of it with organs we don't have. So can you tell us a little bit about the role of testosterone in women and what do we need to know about that?
Definitely. A lot of people don't know that testosterone is produced by women as well. So that's kind of a lot of people, like you said, you were in nursing school and a nurse and didn't quite understand the role that testosterone plays in women. So we as females are born with a very small percent of testosterone produced in our body, not like men that have the beards and the big burly voices, but we need testosterone as well. And like we talked about on the last podcast, as women age, our levels, all of our hormone levels start to get kind of wacky in our mid to late 30s and then start to kind of take a nosedive, and testosterone is one of them. testosterone is very, very important for energy, fatigue, brain fog, and most especially libido. So that's one I really like to kind of talk about, because a lot of women will come into the clinic in their mid to late 30s, 40s, 50s, and just talk about they don't want to have sex anymore. They have no libido. Well, it's not fair, because guys, when they go to their doctor and say, oh, I don't want to have, I can't get an erection anymore. I'm not really like, I want to have sex, but I just can't. They get a little blue pill called Viagra, and they haven't made that for women yet. I'm kind of hoping that maybe someday we will get to have something like that. There's definitely some aids now that are out there for women that kind of will help get them in the mood. But long-term standing, testosterone helps with that. And I think women are pleasantly surprised with that once we get them started on testosterone therapy, that's one of the things that it helps.
Yeah, that's a huge piece in like the dynamic of your relationship too. And as you get older, so I think that's probably like a huge concern for people. How do women's testosterone levels typically, well, I guess we kind of talked about it, like change across the lifespan, but what are some of the subtle signs that people may notice if their testosterone is starting to fluctuate, or besides libido, I guess?
Yeah, energy and motivation.
Okay.
I guess I should have prefaced this episode with, if any of my family members are listening to this, I'm probably going to talk about my sex life. They probably don't want to hear about that, but so just turn away, or if my mom's listening,
Right, earmuffs.
yeah, my daughter, my mother-in-law, I don't know. Like we just said, libido is definitely one of them. Energy is another one. You have to also think in this time frame of our lives, and we talked about this a little bit on the last episode. So if you haven't listened to the last episode, definitely go back.
It's a great one.
We're in a different time in our lives too, in our late 30s or 40s. We're taking care of children. We might be taking care of parents, kind of going through career changes maybe, or advancing our careers. So, women are always tired. We're just tired. We're mentally tired. Like maybe don't have a motivation to go to the gym. We're starting to lose some of that lean muscle mass that we had. We're starting to get that menopausal weight gain, like just exhausted, just don't feel right, not feel right in their skin. We talked about brain fog last time, like just, losing words. I still lose words every once in a while, not as bad, but.
I'm in the hardest, like the last week, word word finding has been so hard for me. Right. I feel like I can't communicate.
Yeah. So testosterone can be a game changer with some of these symptoms, and just kind of all around health when you add them with the estrogen and progesterone as well. But yeah, I think last time you asked me, one of the questions was, when people come to me, what are the main complaints that they have? And usually it's libido, energy, fatigue, and that brain fog. And testosterone really couples nicely with the estrogen progesterone therapy.
Okay, that's going to be one of my questions too. Yeah. So it's like they all kind of play on parts of it and others. Because I didn't, every woman's so different too. As I talk to people, like, what they're experiencing. So it's hard. And I know in men, well, this is what I've heard. I shouldn't say I know, that when their testosterone, it can mimic depression. Like, a lot for men. So, and some of these sound depressed, would make you depressed.
And women, it kind of mimics depression too, that lack of motivation, just like, yeah, I know I got to do it. I just don't really want to do it. And a lot of women will go to their primary or even their GYN and say these things, and they'll get sent SSRI or an antidepressant, because that's kind of it kind of checks the marks. Mm-hmm. And a lot of providers are not educated, or are very uncomfortable talking about hormones, especially testosterone, because testosterone is kind of a newer, it's been around obviously forever, but testosterone in women is more of an up and coming type of thing. It's not been well researched. So it's a very important thing to consider.
I know last time you were like, I will fight you if you try to take my testosterone. You can take everything but that one.
Yes. Testosterone and progesterone are the two that I swear I will go down swinging in the nursing home if they try to take those away from me.
Well, as I'm like, we're talking about symptoms, I'm like, this kind of sounds like similarly with the progesterone and the estrogen too. Do they all the symptoms kind of mix with being low in all of them? So then the treatment also kind of builds together.
They can. And I like to do baseline labs. And obviously, when you're on testosterone therapy, that is the one that we do need to be monitoring some other labs, just due to some side effects. But I always like to get baseline labs. And then again, at 3 and 6 months, whenever I put anybody on any of these therapies. But most importantly, labs don't tell us everything in hormone replacement therapy.
Mm-hmm.
It's changing. I think new research, new protocols, we're going to get some better clarity over the next couple of years. But I really like to look a little bit at the numbers, but not concentrate on the numbers and treat the symptoms. Like,
Yeah, that's what you said last time, and I
yeah,
loved that because it was like there's a lot of variation, right? And we don't know as much as we could know, it sounds like.
I feel like in a lot of the testosterone levels that are what they consider normal. So like I would draw your blood and check your
Mm-hmm.
testosterone level. And let's say it says, oh, it's normal at 36. Well, that fits that normal range. But now that we're learning more about how women are feeling at the higher levels with no side effects, for me specifically, I like my testosterone levels. I can feel a difference between 200 and 250. So that's the highest normal level is 50. So whenever a doctor that maybe is not educated in the levels looks at mine and they're like, oh my God, you're at 250, like, holy crap, that's way too high. We got to get you down or what? That's not necessarily true. I'm not having any side effects of it being that high. And I feel my best when my level's at that level. So
Interesting.
it's
That's exactly what happened to me. I went like in my 30s and they were like, everything is totally normal. And then I got an antidepressant, which didn't help. But I knew early, I feel like I've always been like in touch with my body. So I knew things were changing and I was desperately trying to figure out what it was. So I love that you say that.
And just because mine is, I feel my best at 250 doesn't mean that, you might come in and we start you on this and you feel great at 100 and you're like, I want to stay in this range. Or somebody might want 300 and 350, and it also depends on their lifestyle. Do they work out and lift weights every day because they're going to burn the testosterone more? Do they have a lot of lean muscle mass? So there's a lot of play to it. It's not a one size fits all. None of these hormones are a one size fits all playing field.
So at what point do you think women should consider getting labs drawn and checked? Like the beginning of I guess late 30s, like we're talking about?
I see a lot of women coming in between that 38 and 42 level right now, or 38 and 42 age range. I think that's a great time to start maybe kind of exploring, like maybe this is why I'm feeling this way. Now, of course, a lot of other comorbidities kind of develop in our later 30s, early 40s. Some autoimmune disorders might show up during this time. So you need to do hopefully your provider's doing their due diligence. And if I come to you and I say, oh, I'm so fatigued, I just don't feel like doing anything, we rule out it's not depression, anxiety. Hopefully your provider is at least doing some other labs for arthritis or autoimmune disorders before they jump the gun and start on hormone replacement therapy, just because I feel that's important to kind of point out. Hormones aren't the answer to all our ailments. But mid to late 30s, 40s, I'd see that age range, early 40s, probably definitely people start kind of filtering in to start getting a knowledge base on how they're feeling.
With testosterone, is it one that so I guess not just testosterone, but HRT in general, is there like a pattern of how you usually start people? Or is it or is it just symptoms based? Like do you usually start people with some progesterone and then testosterone is what you add last? Or is it like everybody's different?
Everybody's different. So everybody wants a quick fix. And unfortunately, this is not a quick fix. For me personally, it took about 7 to 8 months before I got my levels, my estrogen, progesterone, and testosterone where I wanted them to be. So, and it's case specific. Some patients, if they already have been on hormones, we kind of know where to start. I like to start people usually on the progesterone pill that they take at night. I feel like that one is probably the most beneficial and it is the fastest working. So they feel like, oh, this is like a huge difference. I just had 2 patients in the last 2 weeks message me after I started them on progesterone and they're like, I noticed a difference immediately. I'm sleeping better. I feel better. Like sleep is
Well,
always,
then just all the effects sleeping better has on your life
yeah,
too. Like just that one
absolutely.
thing, right?
Yeah. If you can fix that. So I usually like to start out with progesterone. Now, if they're coming to me and they're not sleeping and they're having like a million hot flashes and some different things, we might start the progesterone and estrogen together. And then I always usually add testosterone in about 3 months after I start. Not always. Sometimes if their testosterone is literally below zero, like you get that like under 3 level, we might throw in a little bit of testosterone just to kind of see how they react. The one thing I don't like to do is throw a bunch of new stuff at somebody because if they have a side effect or something's not working, we don't really know which one to adjust.
Oh yeah. And then you don't know
So,
what's safe. That's a great point.
yeah,
Very
so
good.
it is. I just tell everybody low and slow. Everybody's different. Their treatment plan is going to be a little bit different. So just because I start you on all three right at the beginning, your friend that comes to see me, I might say because of their symptoms or their background, like let's do one at a time. Let's try this or do two first and then kind of play it by ear.
Now, so I was talking to one of my coworkers. I work with a lot of women in this age gap, and I'm a nurse, so it's like weird gabby women all the time about what's going on in our lives. But so, like for me personally and her, I feel like my sex drive has actually done the opposite. I feel all the other side effects, but I feel like my sex drive is like hyperactive, like
Oh,
it went the
congratulations.
other way. Well, yeah, I know. I'm not trying to show off, but so
No.
then I'm like wondering, am I still having testosterone problems? And she said the same thing. She's like, I actually feel the opposite. I was like, me too, and I don't want to like brag about that because I'm not,
Yeah.
but I don't feel that way. But I do feel the other stuff. So is that normal?
Yeah, absolutely. I was going to say congratulations because you're like one of the very few that don't have that problem. Dang, good for you. But you still could have some lower levels, especially so estrogen and testosterone can kind of balance each other out. Sometimes one can make one higher, one can make one lower, and probably don't want to get into all of the chemistry of all of that. But yeah, so you can still have some lower testosterone levels and still need help with the sleep and motivation and kind of things. So
Yeah.
we depending on your level, we probably wouldn't start you off straight away on the testosterone. We would look at the estrogen, progesterone first, start those, kind of see how you feel, and then maybe start a very low dose testosterone to kind of maintain.
Okay. What are some of the biggest myths or fears that you hear with women and testosterone? I mean, I've heard some, but like, I don't know, like, hair growth is the biggest one I've heard people complain about, but what are some of the others?
People are really worried about waking up and looking like Arnold Schwarzenegger.
You're like, that doesn't even work for men.
Yeah, like I can tell you, like probably that's not going to happen. But yeah, worry about bulking up. Now, I will say women that are into weightlifting, it definitely helps with the muscle development. But I don't think that for me personally, I would not be prescribing a high enough dose that you're going to be like roided out, in that power building type of body style. The facial hair growth is always a big concern. Women do need to keep in mind as we get older, we naturally will start to grow more facial hair because of the hormone changes. Sometimes that's not helped by hormone replacement therapy. Sometimes it actually can increase a little bit with testosterone therapy. I've been on testosterone now for over a year. I don't have a beard. I don't get the black crazy hairs yet. I mean, I might still develop that in my 60s. Who knows? Again, I don't use the high enough doses where they're rapidly going to develop some problems. Now, would I say that I feel like I have like that like fuzzy hair a little bit more? Yeah, and that's true with aging as well. I love, total side note, but I love that my daughter showed me that spray. Have you seen that for dermaplaning?
No.
Oh my gosh, it's on Amazon. This is just a fun thing you can do. And
Love it.
you have if anybody does this, you have to record yourself doing it or take a picture. So you get this spray, it's for dermaplaning, and it makes you look like Santa Claus. Like you spray it on your face and it outlines every little fine hair that you have for you to use the little dermaplaning tools to get it.
Oh, wow.
And so my daughter showed me this, and I'm not kidding. Like the first time I did it, I was mortified. I'm like, oh my gosh, I had that much hair on my face and I didn't realize it.
Yeah, that was the first time I did it too. I'm like, but I think that's normal. I just didn't notice it. That's what I tell myself. But I come from a pretty like hairy family, and I have had like their hair removal from like my armpits down. But I'll tell you that always, like, regardless, I got like a hair on my chin in my 20s, and now I don't have more than that. It comes and goes. Like literally, that hair that I got in my 20s, that same one doesn't pop up anymore. So I really do feel like it's hormonal because some periods I'll have like 3 black hairs pop up
Yeah.
somewhere. And then other ones I won't see it for like 6 months.
Yeah.
So, and that's been my whole life. So,
Yeah.
well, I can comment after if I ever started, after I do the therapy about the hair growth. So we'll have to revisit this question.
Yeah, absolutely. The other thing people get really worried about is the low voice. Like their voice is going
Oh,
to change.
I didn't even think about that.
So that is very, very possible with high doses. So one of the things that we'll talk about probably later on in this discussion is about the testosterone pellets. And not to go too much into them right now, but I have had a couple of patients that had those at other clinics and got their testosterone like super, super high, and their voice did drop a little bit.
Oh, wow.
So, and then the other thing that people will comment about or question about is the clitoris. So it can make the clitoris down in the vaginal area a little bit larger. It's more sensitive. So orgasms are stronger. We're not talking like it's going to get like most women don't take enough testosterone in this traditional therapy type of setting to make the clitoris so enlarged that it's like protruding or makes a difference. But that's a concern that people will, they've read about it or seen about it and seen something about it and they question.
Is that related to blood flow to the area? Because that's usually what feels good, right? So I do have another question. I'm so glad you brought that up because I heard this. I don't know if it was on a podcast or what someone was saying. And I was like, whoa, that's one of the menopause things I had not heard yet, which that your clitoris can actually shrink as you get older. And so I was like, bring on the testosterone. Yeah. Like that women sometimes have harder times achieving orgasms. Like when they've been with the same partner for years, because all of a sudden they have less going on.
Yeah, so sensitivity changes down there because of blood flow. And then I don't remember if we talked last time about estrogen in the vagina.
I don't think we did.
So estrogen, and it's totally sex related. One of the biggest complaints that I get from women that are postmenopausal or even just premenopausal or post hysterectomy is their vagina is very, very dry.
You've heard that, yeah.
And sex hurts.
Oh, yeah, I've heard this one too.
They're like, it feels like razor blades. Like whenever we have sex and I'm using water-based lubricant, like I don't understand. Like, so we go through everything, like water-based lubricant, like what are you using? And it's estrogen. So estrogen decreases and it shrinks everything up. And so replacing the estrogen in the vagina specifically, so using an estrogen suppository at night before bedtime, usually just a couple of times a week, helps kind of plump up those tissues down there. And it helps the clitoris to keep that, with testosterone especially, kind of helps that from shrinking and kind of pulling back up inside the vagina. Another very, very common side effect, I guess, of perimenopause, menopause is women will say, I used to never get urinary tract infections. And now I'm getting them every month. And I don't understand it because I'm peeing before and after we have sex. I'm drinking plenty of fluids. I haven't changed my diet. Like all of a sudden I'm getting these recurrent things. And it's because everything is kind of shriveling up in itself and bacteria is being trapped. And it's the decrease of estrogen. So
interesting. That is so interesting. Okay, this might be a little off topic, but this is a common women issue. I know some women just in general have trouble achieving orgasm. Like it can be difficult. So can maybe like take the perimenopause out of there, just in general. Can hormone replacement therapy help those women? Is that another thing?
Absolutely.
Oh my God, breakthrough. Everyone listen. I'm like, what? That's awesome.
So this is one of the topics that I talk about sex, 30 plus times a day at work usually. And again,
it's important.
If anyone that knows me, my husband or family members are listening, like please close your ears. But yeah, like it has made testosterone specifically has made such a difference in our sex life. Because I think as we decrease the estrogen, testosterone hormones in general, as we age, things feel different down there. Sex definitely changes. Our vaginal area changes just in the way that things are felt. Our nerve things change. So we start these therapies and it kind of like rejuvenates everything, right? And like I hate to say it, but like, my husband and I, like, we'd have sex once or twice a week and I'd kind of be like, oh yeah, I'd enjoy it. Like it was great. But now it's like really great. And it's like going back to your 20s, when you're like a hormonal teenager and you just want to have sex all the time or make out with your boyfriend. And it's kind of like, okay, like I'm the one initiating it way more than what I used to initiate it. So
So your husband's like, yeah,
yeah, well,
finally, I've been waiting for this.
he is so like I've heard him at some of our friends' parties, like the topic always, somebody's always going to ask me questions about it, and he's always like, "Yep, got to do it." Like telling the husband, like, "Yep, definitely get her on it." Like
Well,
it's a game
that's the
changer.
truth, though, is that like it is such a relevant issue for so many people across for women, especially across like your whole lifespan, really. There's not a lot of people you can talk to about it. And even when you go to a medical professional, I don't think a lot of people know enough about it to even find the information if you're looking. So it's great that like somebody finds somebody like you. They're like, oh my God, just well, I've got you here.
Yeah. And so I'm a lifelong learner. Like I plan
Oh,
on,
me too.
I'm always taking classes, and right now I'm in the middle of another menopause certification. But my next one, actually, I want to get certified in sex therapy, or like not necessarily like sex therapy, but like more in the sexual aspect of it, because people don't want to talk about it. They're embarrassed to talk about it. They don't know the right questions to ask. And it's cute because my patients know me and I'm very open. Like I'll tell you, like whatever you want to know, like I'll explain it to you. But we we need to know that like everything down there does change, and especially like you said, those nerve endings, like our orgasms usually as you get older, your orgasm, a female's orgasm is more clitoral based, so clitoral stimulation and not penetration based because of the changing of everything down there. And so a lot of women might feel really awkward like talking to their partner about like, I
Changing
really,
things up, yeah.
yeah, like
And asking
maybe
for what you need, yeah.
absolutely, like I don't think Kyle's surprised about anything that I ask anymore. I'm like, let's try this, or like because I read that this works, and then I'm like, yeah, that definitely worked. We're going to do that again. But yeah, our nerve endings change. Things that feel good now didn't maybe when we were in our 20s, or vice versa. So that's very, very important. And I think the testosterone, when you add that back in as everything's kind of decreasing along with the estrogen, really is a game changer for relationships, because you always hear about midlife crisis and
For
yeah,
both.
absolutely, for partners kind of growing apart. Well, intimacy is a huge part of that. Like you don't want to lose that because you want to be
Yeah.
connected to your partner, and touch feels different, and that
Yeah.
emotional connection. That's all menopause related.
Yeah, and I've heard, I don't know if this is true, but this is what I've read is that like for men, sex is a really important part of intimacy for them to feel connected. So like knowing that you want to be able to provide that for the person
Right.
you care about, and if you're not feeling it, that's an awful feeling.
Yeah, and I think it needs to be like I hope some guys maybe, or maybe women will show this to their husbands or significant others. Like women feel connected usually by like acts of service, like
Mm-hmm.
them just randomly texting I love you, doing something in the kitchen, like doing the dishes or taking care of the kids for the night, kind of taking something off of their plate every once in a while. And then just that touch, like holding hands,
Mm-hmm.
touching of the back, a kiss on the neck, like just that, like that's gonna make your woman like more like that's kind of how women get their sensitivity of like, oh, like okay, like let's do that tonight.
Yeah, feeling taken care of in that way is
Yeah.
how we feel intimately connected to someone.
Yeah,
Yeah.
it's a pull, push pull type of thing. So it's like if you want one thing, you need to do some things for me too.
That's right. I love it. That's great. So what forms can people take testosterone? I know you mentioned the pellets, and I didn't know this, but pellets are apparently a hot topic because when I was like researching this episode, it was like pellets are a hot topic right now. I was like, okay.
Absolutely.
So tell us about how we can take testosterone, or how we should or could.
Yeah. So there's several different forms, and I want to preface this with none of these are FDA approved yet because it's considered still very controversial. Like I said, I think this is all going to change over the next couple of years. So there's the creams and gels. So they would come from a compounding pharmacy. You'd meet with your provider. They would do your labs, talk about symptoms, and then say, okay, I think you would benefit from a cream or a gel. This is kind of usually the entry level form of testosterone. And why I say that is you can just stop taking it, right? So it's a cream or gel you put on every day. And it's the kind that I prescribe from the pharmacy that I use. It looks like, I wish I had some here. It looks like a deodorant stick. It's a little white container. You pop the top off. Your dose is how many clicks. So like most women would start out at 4 clicks. So every morning before you leave for work, while you're getting ready, you would click it. So 4 clicks comes out like a deodorant. You put it on the inside of your arm, the inside of your thigh, and you'd alternate every morning. So I always alternated from arm to arm and then thigh to thigh. And then it takes about 30 seconds, a minute to dry. I would, during that time, I wouldn't get dressed yet. I'd brush my teeth, wash my face, kind of start my morning routine. You'd let that dry because it's important. You don't want to touch anybody while it's dry, like your kids or,
Yeah.
the transference of it. But you let that dry, it slowly absorbs. It does take a little bit longer to get built up because it's a different delivery method. It's a little bit slower using that cream for absorption. But a lot of people really like that. And most people are very, very happy with that. Once we kind of get them built up, you're putting deodorant on every morning, I hope, right? Most of us are.
Yeah.
So it's just kind of a easy thing to do. Really no side effects with that one. We're going very low and slow with that one. I've had one person complain she had very sensitive skin of some skin irritation on the inner arm. Once she moved it to her inner thigh, she didn't have that issue. But that's the gel and the cream. And then the gels, you can also put those on the back of your shoulders. That was another delivery place. Most people don't like to do the shoulders. Just
that'd be hard to reach.
Yeah. But that's another place you could put it. The injections, again, it's an injection you'd have to give yourself, subcutaneous, so just a little tiny little needle once a week in the stomach. There's some difference, not to go into great detail, but some providers want women to do them twice a week. Some want them to do it once a week. It just kind of depends on who your provider is, what they're comfortable with. But super tiny, it does raise your doses a little bit higher faster because it's being injected directly into the body. The one complaint that I get about those is they raise you really high or higher for that. Like, let's say you do it on Sunday, your level is probably like Monday, Tuesday, Wednesday, you feel great and all this energy. And then maybe the last 2 or 3 days, you're kind of like, it's okay. Like, so there's kind of that peak and trough of it. So it's not a consistent level. And then you have the pellets. So the pellets are plant-based. You can get them from different med spas. Usually I do pellets. I do pellet insertions in Godfrey, Illinois at the BioID clinic, separate from my other office. But it is a medical procedure. So another thing, I guess, to talk about between all of them is cost. So the gels and the creams and the injections are usually anywhere from like $40 to $80 a month, depending on the dose and the pharmacy and where you get them. Sometimes a little bit more money. The pellets are a little bit more expensive. They're anywhere from $400 to $500. However, you don't have to come and get them as often. So 3 to 4 months. So you're coming in 3 to 4 times a year. It is an outpatient medical procedure kind of thing. I say outpatient, it makes it sound really like a surgery. It's not. We have you come in after labs and consultation. We put them in like the upper butt cheek area. I numb the area up with lidocaine. And then I use a little instrument that kind of inserts the pellets underneath the skin and where they dissolve over the next 3 to 4 months. The pellets are about the size of Tic Tacs. TikTok.
Yeah, that's more popular nowadays.
Right? So they're super little. You can't really feel them under the skin. They dissolve pretty quickly. There's always the risk factor of infection because we're putting something under the skin. I've had one patient where their body just naturally kind of expelled them.
Oh, yeah, I've seen that.
So kind of pushed them out. That doesn't happen very often. And I've never had anybody really have like a reaction, like a medical reaction from them. I'm sure there's cases of them, but me specifically have not had any patients say anything about that. Patients seem to love them. Usually their testosterone gets really high over the first 4 to 8 weeks. Great reaction to libido, energy, motivation. They do usually feel like the last 4 weeks is before they're getting ready to get due for the next injection or the next insertion. They do start to feel that downward. Like it's not and when I say downward, I don't mean it to sound like all of a sudden that testosterone stops and they're like, I'm exhausted. Like I hate everybody. It's not. If they can just feel a difference from whenever they first
like the tapering off
Yeah.
is starting to notice. Now you said something earlier about someone getting a deep voice. Was that like
It was with the pellets.
okay.
And the particular physician that put those in at this clinic that she went to, like We do a lower dose and then work patients up and kind of make sure they're not having side effects, or they like the dose that they're at, that are getting the desired effect. They're lasting as long as we can get that 3 to 4 month window. This particular provider, in my opinion, after looking at her doses and her side effects, just went like almost triple what we would normally do.
Okay.
And they said that that was their standard practice. So everybody's a little different. I just feel like for her, after looking at her labs, the side effects and what the doses she was on, it was way too much for her. Her voice did get better. It did recover.
That was my next question. I was like, does it come back? Okay.
Yeah, it does. It took her a little while. And of course, she was scared to death to start on pellets again. So now she does the cream. She's more comfortable with the cream. She's getting satisfied. She's satisfied with that. But it was kind of scary for her for a minute.
Oh, yeah, I get it.
I don't want this voice problem. I don't want. So yeah, like I think everybody's provider's a little different on that. But I just felt like for her, after looking through everything, I was like, oh, that probably wasn't the best option for her.
Right. So what can people expect? Because we talked a little bit earlier about some of the we talked about the side effects of like maybe being low, like, just like the changes in our muscle, like our body, the fatigue, the brain fog. What things can we expect to see an improvement in? Because personally, one of the things I was, again, laughing at work about is I was like, I went to sit down. It was probably like 4 months ago. And my inner thighs actually like slapped. And it's not, they're smaller than they've ever been. I feel like in that area, it's the consistency of my fat or skin down there. It's just different. It's like it will slap now. And before it was like thicker and it wouldn't. So like, are those things that are possible to see a change in? Is it just the emotional things?
It's a little bit of both. Like your body composition definitely changes as we age. Everybody knows.
It was traumatizing if you can't tell.
Yes. Especially since you're like, oh, this happened. Body composition, everything changes. Or especially women, we start to lose. My brain's not working. We start to lose that lean muscle mass. And estrogen and testosterone can definitely help with that. Testosterone, especially if you add in, and we're not saying go bodybuild and, go to the gym 7 days a week and do these just light weights, I'm looking at my 3, 5, and 8 pound weights over here. I have some 15 pounds. I don't use the 15 pounds very often. But even just the 3 to 5 pound, and just doing some mild exercises will help keep that muscle mass where it needs to be. Unfortunately, though, there's some genetic issues or age-related changes that we can't reverse. But I've seen some women that, I guess, kind of going, noticing these midlife changes. I've noticed some friends of mine that are now in their 50s that are signed up now to run their first marathon. They were never runners before. And they're like, I wanted to change my body mass. So I started lifting weights or doing yoga. And then one thing kind of led to another. I have one testosterone patient right now who she's a bicycle, like she does the bicycling, like hundreds and hundreds of miles. And she's like, yeah, I never did this when I was younger. And now I want to do this. Like I have that motivation. So was it her, just her mind changing the way she thought, or was it the hormones that giving her that that motivation to change? It's really hard to say. Now, I will say personally, I want to work out more than I do. And I know that I need to work out more than I do, but I'm probably the busiest that I've ever been in my life. So the hormone replacement therapy has definitely been a good, it's been very complimentary to my current life of being a busy mom, working. My business is booming for this education stuff, which I absolutely love. So I probably could work on my lean muscle mass a little bit more, but the hormones have given me that motivation and that energy and that drive to do this. So
I love it.
Yeah, I mean, you might not be a person that exercises. I don't like exercising at all, but it'll help in other ways as well.
Well, it's hard to do that stuff when you're tired, when you're fogged, because then everything starts building up. I mean, you start spiraling when you don't feel good. It's like the things that are possible when you start clearing things off your plate can be very surprising. Yeah. So what's a realistic timeline for women to start this kind of therapy and one, start feeling the benefits, two, like get to a place where they feel somewhat stable?
Frame. I have a couple of women in their early 30s getting testosterone replacement therapy. A couple of them are doing pellets. A couple of them are doing creams. The main thing with that when you're still in childbearing years is we don't want to get pregnant when we're on testosterone. We
Oh,
don't
okay.
really know the effects. So they need to be on birth control, tube tied, whatever they need to do for that. Because I'd be very hesitant to start it on someone who's still planning on having more children.
Hmm.
Just because of the research, we really don't have a ton of long-term research on all these therapies. But for getting started on like feeling different, usually you feel different within the first 3 months, depending on what form you pick. The gel takes a little bit longer. The injections are a little bit quicker, and the pellets are almost immediately after the first 4 weeks or so. So yeah, any age, starting at age range, I think the youngest person I had inquire was 27. We opted not to start the testosterone with her because they still wanted to have another child or two. But yeah, so time frame is really little. Benefits is a little bit different on everybody.
Yeah. So is there anything we can do? Like we've talked about weightlifting, and this is one of the examples that I have a question about. Is there anything we do that would help us build testosterone in ourselves? Do those activities actually help, or are they just better supportive?
Better supportive, definitely. But there's a lot of diet. I don't have it in front of me, and I wish I could pull it up in my brain. There are a lot of diet therapies and exercise regimens that will help naturally increase testosterone, more so in men because they naturally produce testosterone. Dr. Shearer, Jacob Shearer is one of the chiropractors that I work with that I do pellets with. If you go to his business page, I think it's his personal Facebook page, but it's private because he's public because he talks about his journey with different things. He naturally increased his testosterone by doing some diet changes, some weightlifting changes. I can't speak to 100% how it's affected for women because we don't have the sex glands that naturally will produce the higher levels. But I know that there's a lot of natural supplements that claim to, but I'm not really well versed on those. But yeah, definitely the exercise is a big proponent. Exercise affects hormones all around on many different levels.
That's
And
good
that
to know.
helps.
Is there anything that we may be doing that would unintentionally lower or work against us with hormones at this age that we could be doing? Like, is there any diet things? I mean, everyone always says like avoid sugar, but is there anything that we know
Yeah,
of that works against us with hormones?
alcohol
Okay.
consumption.
Yeah.
And yeah, in diet, the alcohol, sugars, and glutens really are
Okay.
processed foods. The same ones that, I feel like that we beat this to death, like on preaching about decrease your sugar, decrease your processed foods.
It's the same stuff every time, but it
Yes,
still was good for you.
absolutely. Like it still is very relevant, especially when talking about hormones.
Yeah,
And I
that
think
makes sense.
yeah, because if you look at a lot of our younger patients that are just starting their menstrual cycles, usually we have a lot of women who will come to me that are overweight that aren't having regular menstrual cycles, and it's because of their diet. So it's all still related as we get older. It just kind of affects us in different ways.
Oh yeah, we've all heard of that when you were really young. I remember like there were some really active, very small girls that would delay their period. Like I know like professional athletes, if they were very intense, their periods get delayed sometimes even into their 20s from that.
Yeah.
Interesting. I never like obvious. You would think that would connect,
Yeah.
like, oh, but it didn't until now. So yeah, of course. So if women are listening to this or let's say they go to get it checked out and they feel dismissed by whatever provider or like they're told like everything's normal and they're like, wait, but it's not. One, what advice would you have? And two, are there things they can ask or say to their provider that would help them understand whether that provider has like a good understanding of hormones and they should move on or not?
Yes. So I'm a big proponent. If you feel dismissed by your doctor for any concern, find another doctor.
Me too. You need to be heard. You need to trust them.
I hope that I have never made any of my patients in the last 12 years feel that way because that to me is like right there. If you don't feel comfortable or something is said that you're just like, that doesn't set well, find another doctor. There's plenty of other providers out there. For hormone replacement therapy, menopause, perimenopause specifically, the Menopause Society has a website. I don't have it in front of me, but it's if you search the Menopause Society, it is a group, tons of questions to ask your doctors, tons of educational information. It also lists the providers in your area by zip code that are going through the classes, that are getting the certifications, that have knowledge, that are not going to turn you away if you bring up the big, HRT, and they're not going to shut down immediately. So make sure that your provider, or if you're looking for a provider and you're not feeling comfortable with who you're with, go to that website. And it's amazing. You can order books on it, reading material. They have free educational material on there. They have material for providers and to patients about what you should be feeling, what you shouldn't be feeling, how to fix it, lifestyle changes that will help. So it's a big resource.
Great resource. I think you might have mentioned that last time about being able to find the providers, and I forgot. But I wish there was that kind of database for everything. Like, that's awesome.
Yes.
I love that.
Yes.
Okay. Well, so I always ask everyone what their go-to self-care is. So we've already done that. But is there anything you would like to say, I guess, to women who would are in this stage of life right now? Like, is there anything you would like, a message that they need to know?
Don't suffer. Like, I feel like so many women are going through this. They don't really, maybe they don't have the friend group or the sister to kind of talk to them about all of these changes. My mom specifically, like in the 90s, had a hysterectomy. She doesn't, she can't relate to a lot of these things that I was kind of going through. And that's why I kind of took it upon myself when I realized that, oh, I'm in my early 30s or early 40s, and I have women that are coming to me asking me these questions, and now I'm experiencing the same thing. That's why I kind of set out the last couple of years to learn all of this for education purposes. But yeah, ask the questions, don't suffer, and find, I think we talked about this, find your girlfriend group. Find that
Yes, I love this. Find your people. I love
people, because I couldn't do everything that I'm doing without my supportive husband and family and my group. Like, without my friend group, oh my gosh, I'd be totally just lost. And it doesn't have to be a big friend group, just finding that one or two people that you can confide in. So find your people and find your voice. Like, so many good resources.
Great advice. I love that, because if I think back to when my mom started this, and I think she started in her late 30s, and now she's like full blown in like the ends of it. Like, she still has a period, but like she's feeling the mass, she's in the tail end of it. But I think for her, it started quite early. And I can remember so much shame. I just remember like my friend cut her hair and was like, I got some hair thinning. And she was like, not another word, like death stare. My friend calls me up like, oh my God, I said this to your mom. Like, I just remember it was so not talked about. And, like, people just suffered in silence and didn't know. You don't know what you don't know,
Yeah. And I think we're in a really exciting time for women right now. Like, I feel like we're getting seen now in healthcare a little bit more than what we were. I think podcasts like yours, especially, like highlighting women in different fields and in different topics. And we have access to more information now. So people maybe aren't feeling as kind of alone in these situations. It's kind of exciting and it's fascinating. And I'm so excited to be part of like kind of this new like journey for us.
Yeah.
I don't want my daughter. I only have one girl out of 7 kids. We just have the one girl. And I don't want her to have to, I mean, she trust me when I say we're very open. She tells me everything, and probably more than I want to know sometimes. But I don't want her to feel uncomfortable going to her doctor when this kind of stuff happens. Or her friends. Her girlfriends call me all the time and, will ask me questions. Is this normal? So I want that to be more the norm. I want, sex to be talked about a little bit more without it being so taboo still.
Right.
I want the changes.
Let's talk about the right parts of sex and not, there's a lot to talk about.
Absolutely. It's good. Like, like we need to embrace that. It's necessary. But yeah, I just want, the voice, just be heard. I love it.
Well, thank you so much for being an advocate for all this positive change and coming and teaching us. And then again, and good luck to you. And if you go back for sex therapy, I would love for you to come teach us then too.
I just started looking up those certification classes about a week or so ago. I'm like, that's I have a list, like my bucket list.
Oh, me too.
Certifications, and that went on there. So yes, it'll be coming, definitely.
I love that. Well, thank you so much. It's been an absolute pleasure.
Absolutely.
That's a wrap for this episode of Empowered Ease. I hope you were inspired by today's guest and felt empowered by their story. Our listeners have been growing, and I am so thankful. Welcome. You can aid in that growth by helping us by liking, subscribing, and leaving a review. I'd love to hear your feedback and suggestions for future guests and for how you are empowering others in your community. So until we meet again, keep challenging the norms and empowering those around you.